I'm Martin Webb. I am a member of the Palm Drive Healthcare Foundation Board. I'm the retired principal of Anley High School, lived in Sebastopol for over 30 years. Palm Drive Hospital has been very important to myself and my family. It's really important that we have an emergency room here. It's important that we're able to have surgery here in our own hometown. In case of emergency, small hospitals like Palm Drive will be critical in the case of an earthquake or other emergency. I support opening Palm Drive Hospital.
My name's John Moise, and I'm supporting Dennis Colthurst and Rich Powers for the Palm Drive District Board. I'm doing so because I firmly believe that they will be able to reopen the hospital. As a professional in healthcare, I know Palm Drive Hospital can work. I also know that a closed emergency room means lost lives. It's time for Palm Drive and Sebastopol and the West County to be safer by having the hospital reopen.
I'm Dennis Colthurst. I'm on the Palm Drive Healthcare Foundation and running for the Palm Drive District Board. It's clear the community needs a hospital. We need an emergency room, and the public safety is being compromised by the fact we don't have that. If elected, that's what I'm going to do. I'm going to open this hospital.
Hi, I'm Dan Smith, and I support Rich Powers and Dennis Colthurst for the District Board. I think it's really important we get our hospital back and open again. It's been here for 70 years. This is the first time it's been closed, and we need to elect Dennis and Rich to that board.
Hi, I'm John Finnegan. I'm a nurse. Used to work here at Palm Drive Hospital until it closed in April. I really believe this community needs a hospital. I also live in the community, and I talk to a lot of people in the community. I have a lot of friends and acquaintances. They all believe that there should be a hospital here. I've heard a lot of horror stories of people going to other hospitals and not getting the care they need. This is really a great hospital, a really unique hospital, and I really hope we can get it back.
I'm Dr. Richard Powers, a family doc here in Sebastopol since 1975, and I'm standing next door to Palm Drive Hospital on the heliport, which we really have the best heliport in the area for getting evacuation to San Francisco or to Oakland Children's. We've sent many children from this place to life-saving emergency care in Oakland, and other people to CPMC in San Francisco and various places that had been used more for getting the people who were drowning victims from the coast here to Palm Drive in a hurry. Unfortunately, Palm Drive right now is shuttered because of financial problems. There is a plan, though, that will really make it a successful hospital, which won't go broke, it won't cost more taxpayer money. There really is a plan offered by the foundation, Palm Drive Healthcare Foundation, and that plan really needs to be implemented. I'm running for the district board because I want that plan to be accepted. And it's not certain that the current board is of the mind to accept that plan because they've had difficulty with the financial failure of the hospital twice now. But the plan is different. It has a board that will be including great business people who've proven their success here locally and advised by physicians, none of which has been part of the previous plan. So the change of way of doing things is why we'll be successful. The other part of the plan that's being offered is really that there'll be some specialty services we have great need of, endocrinology, rheumatology. These are things that we would love to have available and be good for the whole community because they're scarce all through Sonoma County and even more scarce up north of here. So we expect to draw patients in from outside who will be able to utilize Palm Drive and partly grow the business through that. And things like urology, which are essential services, will be provided in highest quality here. Even at neurosurgery will be available, and we have a wonderful neurologist helping us to make this a very growing and successful place, different than it was as it went down through decreased census. There's also the prospect of getting more patients back from Kaiser because there's programs that are price competitive. We already have Western Health Advantage. That's a plan for people below 65, employed people and single and people who are buying their own insurance. Costs the same as Kaiser. It's been here a year and a half, and coming this fall for implementation in January is a program from Southern California called SCAN, and that program is a managed Medicare competitive with Kaiser. So we won't lose people just because it was 20% cheaper to have Kaiser, people who really would prefer local care and care here in our wonderful hospital. The other thing that was unique about Palm Drive was the nursing, and actually even the housekeepers and the clerks and the technicians all really cared about the patients personally and went out of their way to make them comfortable, to help them get well quickly. That's not been done as well in big hospitals, and it's really a very special part of Palm Drive. One of the things I favor the most about Palm Drive. Other things that will be improved are our emergency room. Will be by far the shortest wait in the area. There are some other good ones in Healdsburg and Petaluma Valley, but waits in Santa Rosa are extremely long, and people can come from Santa Rosa, get here, and taken care of before they'd even be started being seen in some of the emergency rooms in Santa Rosa. So I think we'll draw people for that.
Open our hospital!